Wouldn't you like to live a long and healthy life? How about your current or future children? Imagine if you could have prevented giving lung cancer to someone close to you. Would you do whatever it takes to stop it from happening? These are just some of the many risks caused from smoking cigarettes. We all been through some sort of educational counseling in our lives as a pre-measure to stop the use of this drug, but how much of it do we take serious? My name is Samuel Han, and I've too used this drug at one point for many years. However, I will illustrate a vivid image in your mind through facts and statistics the horrible aftermath from such a vile drug. Today, I'm going to talk to you about the health risks of the user, secondhand smoking, and pregnancy complications. You must always keep in mind that smoking cigarettes can ultimately kill you. According to the CDC, smoking cigarettes is the leading preventable cause of death. An active cigarette smoker is vulnerable to health risks such as heart disease, stroke, and lung diseases. For example, smoking cigarettes cause about 85% of lung cancers in the United States. According to a Surgeon General report, nearly 1/3 of all cancer deaths every year are directly linked to smoking. Cigarettes contain over 7,000 chemicals and compounds which are toxic and known to cause cancer. It is clear that smoking cigarettes is harmful for the user, but there is a higher health risk for people around them. Secondhand smoke, which is also known as SHS, is defined as involuntary smoking or passive smoking and can also cause cancer. The side stream smoke, which is smoke from the lighted end of a cigarette, has the highest concentrations of cancer-causing agents, also known as carcinogens, as stated from the American Cancer Society. There is evidence that suggests SHS is linked to childhood leukemia and cancers of the larynx, pharynx, brain, bladder, rectum, stomach, and breast. Each year, SHS is responsible for about 3,400 lung cancer deaths in non-smoking adults. Many people directly link lung cancer with smoking, but studies show that SHS is responsible for various heart-related complications of a non-smoker. Chemical agents from smoking cigarettes can immediately affect the heart, blood vessels, and blood circulation, which also contribute to heart disease, strokes, and heart attacks. A death toll of an estimated 46,000 counts due to heart disease is primarily linked to secondhand smoking. Another harmful risk from smoking cigarettes is having pregnancy complications. Cigarettes during pregnancy can cause various health problems on the mother as well as the infant. According to the CDC, smoking cigarettes during pregnancy causes premature birth, birth defects, and infant death. Smoking cigarettes affect the placenta with complications such as separating from the womb too early and causing bleeding. The chemicals contribute to a risk factor of sudden infant death syndrome, also known as SIDS. SIDS is an infant death, where the cause of the death cannot be found. Some of the birth defects include cleft lip and cleft palate, where the baby's lip and mouth does not form properly. Exposure to SHS also has similar complications such as the chance of spontaneous abortion, stillborn birth, low birth weight infant, and delivery problems. Now that you see how smoking cigarettes can cause many harmful effects, let's recap on what I've talked about today. Today, I covered how smoking cigarettes can harm you through different means such as various cancers and heart problems. The people around you can also be affected with the same harmful risks through secondhand smoking, and sometimes the symptoms can be more severe. Smoking cigarettes can directly cause pregnancy complications before, during, and even after birth for the mother as well as the infant. Now that you have been informed with the health risks that are linked to smoking cigarettes, I hope you keep in mind how dangerous this drug is and share this information with others. Thank you for listening and have a great day.